Good day. Patient Safety Unit is very pleased to welcome everyone to our essential safety training. Our mission every day is to provide the safest possible environment for our patients and for ourselves. This training covers three critical areas that directly impact that mission: infection prevention control, waste management, and ergonomics. Mastering these practices isn't just a requirement, it's a fundamental part of providing high quality, compassionate care. Before we dive in, we want to extend our sincerest gratitude to the leaders who continuously champion our safety initiatives. Thank you, Dr. Nelinda Catherine Pangilinan, for her invaluable leadership in KIPSU. To Dr. Roel Tito Marshall, the head of the performance management team, for ensuring safety is always a core measure of our performance. And finally, to our Medical Center Chief, Dr. Maria Rica Lumage, for her unwavering and continuous support for the Patient Safety Unit. Her commitment from the highest level makes our comprehensive safety program possible. Let's make the most of this session. Your active participation is crucial to making the hospital the safest it can be. Thank you and good day to everyone again.
The objectives of this training are to break the chain of infection at multiple points, to promote hand hygiene compliance, to ensure proper use of personal protective equipment, to ensure safe handling of sharps and prevention of bloodborne pathogens, update the vaccination status of healthcare workers, to recognize common ergonomic hazard in the healthcare environment and identify areas or tasks that contribute high-risk situations, to promote safe work and patient handling and movement, to understand waste segregation categories and ensure safe handling and proper storage of waste.
Good morning. Today, we will talk about the impact of multidrug resistant gram-negative organisms, particularly in bloodstream infections, and what we can do to control their spread. MDR gram-negative organisms cause very high mortality rates, reaching up to 50% in bloodstream infections. They are difficult to treat due to the limited availability or decreasing efficacy of appropriate antibiotics. This high mortality underscores the serious threat these bacteria represent in clinical care. Patients with infections caused by MDR gram-negative bacteria often experience prolonged hospital stays. This increases healthcare costs and raises the risk of additional infections and complications. Treatment is more complex, often requiring expensive combination antibiotic therapies. This contributes not only to patient suffering but also to significant burdens on healthcare facilities. So what can we do? Reducing healthcare-associated infections is a key patient safety intervention. Healthcare-associated infections are a major vehicle for transmitting MDR pathogens. Hand hygiene is the single most important intervention in preventing these infections. Proper hand hygiene practices save lives by breaking the chain of infection transmission. The 5 moments of hand hygiene. These moments highlight critical times for hand hygiene to prevent pathogen spread. Successful implementation of hand hygiene can prevent up to 50% of avoidable infections. This leads to significant health benefits and cost savings. Hand hygiene combined with environmental cleaning and contact precautions is essential to controlling MDR gram-negative outbreaks. Therefore, hand hygiene is simple but incredibly effective. This video demonstrates the correct technique for using an alcohol-based hand rub to achieve proper hand hygiene.
Please note that this technique is not appropriate when hands are visibly dirty or after using the toilet. In these cases, hand washing is required. Hand rubbing should take you 20 to 30 seconds. Use a timer or count 1, 2, 3, 4, 5 in each of the following steps. Apply a palmful of alcohol-based hand rub in a cupped hand, enough to cover all surfaces of the hands. Rub hands palm to palm, then rub right palm over the back of left hand with interlaced fingers and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm and vice versa. To clean the tips of your fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm and vice versa. Once dry, your hands are now clean and safe.
Thank you for your attention. Remember, controlling MDR infections starts with prevention, effective treatment, and maintaining rigorous infection control practices.
Healthcare waste management is a critical component of ensuring safety in medical environments, protecting both healthcare workers and the public from potential hazards. Waste segregation starts at the point of generation, and it is the responsibility of each individual producing the waste to separate it properly until final disposal. Beyond basic segregation, further classification is necessary within major categories such as non-hazardous, infectious, and sharps waste. General or non-hazardous waste is divided into recyclables, biodegradables, and non-biodegradable or non-recyclable wastes, including items like food scraps, aerosol bottles, and biodegradable materials. Hazardous waste includes sharp waste, infectious waste, pathological and anatomical waste, and various chemical and pharmaceutical wastes. To manage these properly, waste bins and plastic liners that are sturdy, leak-proof, have well-fitting lids, and preferably matching colors are used, with liners recommended at a thickness of 0.07 mm, ISO 7765-2004. Waste bins must be strategically placed. Hazardous waste containers should be kept away from patient areas and public spaces, while non-hazardous bins can be placed in public areas for convenience. Yellow-lined bins for infectious waste should be located in areas like emergency rooms, isolation rooms, outpatient departments, laboratories, radiology and dental rooms, infectious wards, dialysis centers, and nurses' stations. Color coding is crucial. Yellow for sharps, infectious, pathological, and anatomical waste, brown for pharmaceutical and chemical waste, orange for radioactive waste, black for non-biodegradable waste, and green for biodegradable waste. Finally, staff handling and transporting waste must wear proper protective equipment, including gloves, sturdy closed shoes, overalls, and masks to ensure their safety and prevent contamination. By following these practices, we do not only comply with regulations but also take an active role in safeguarding lives and protecting our environment, because responsible waste management is not just a duty, it is a commitment to a healthier and safer future for all.
Magandang araw, isang patalastas mula sa Infection Prevention and Control. Halina't makinig at matuto. Sa ating mga tahanan, nais nating mapanatiling malinis, maayos at ligtas ang ating kapaligiran. Inilalabas natin ang basura, ipinaghihiwalay natin ang mga nabubulok at hindi nabubulok. At atin ding pinapanatili na malinis ang ating kusina dahil gusto nating protektahan ang ating pamilya, mapanatiling malusog at maiwasan ang sakit. Ang ating ospital ay hindi naiiba. Ang sentrong medikal ng Rizal o ang Rizal Medical Center ay lugar kung saan pinupuntahan ng mga pasyente upang magpagaling. At tayo, bilang mga manggagawang pangkalusugan o healthcare workers, ay ginugugol ang malaking bahagi ng ating buhay. Dahil ang pagpapanatiling malinis at ligtas ay pananagutan ng bawat isa. Kaya naman, mahalaga ang tamang pamamahala ng basura sa loob ng ospital. Tatalakayin natin ang mga uri ng basurang pangkalusugan, ang wastong paghihiwalay ng mga ito at ang mga tungkuling ginagampanan ng bawat isa sa pagpapanatiling ligtas at mapagpagaling na lugar ang ating ospital. Ano nga ba ang healthcare waste? Ito ay ang mga basura na nagmumula sa mga pasilidad ng pangangalagang pangkalusugan, sentrong pananaliksik at mga laboratorio na may kaugnayan sa mga medikal na pamamaraan. Ang wastong pamamahala ng basura ay mahalaga upang maiwasan ang sakit, impeksyon at polusyon sa kapaligiran. Ang mga sumusunod ay uri ng basurang medikal. Una, Nakakahawang basura. Ito ay mga basura na may taglay na nakakahawang mikrobyo o pathogen. Halimbawa, mga materyales na babad sa dugo at mga kultura ng mikrobyo tulad ng bulak, gasa, tissue, face mask, gloves, napkin, diaper at iba pa. Sa wastong paghihiwalay ng basura, ating itinatapon ang nakakahawang basura sa dilaw na basurahan. Pangalawa, matutulis na bagay. Ito ay mga basura na maaaring makatusok o makasugat. Halimbawa ay mga karayom, scalpel, hiringgilya at iba pa. Sa wastong paghihiwalay ng basura, ang mga matutulis na bagay ay dapat ilagay sa tamang lalagyan ng matutulis o sharps bin upang maiwasan ang pinsala. Pangatlo, hindi nakakahawang basura o pangkalahatang basura. Ito ay basurang hindi nagdudulot ng panganib sa kalusugan. May dalawang klase. May isang itim na basurahan para sa mga di nabubulok na basura at ang berdeng basurahan para sa mga nabubulok na basura. Halimbawa, para sa itim na basurahan, ang papel, pakete, plastik, o lata o balot. At ang berdeng basurahan ay para sa mga nabubulok na basura o mga tirang pagkain. Mga panganib ng hindi wastong pangangasiwa ng basura. Piyansang masugatan at mahawaan, pagkalat ng mga sakit, polusyon sa kapaligiran. Pangunahing prinsipyo ng pamamahala ng basurang pangkalusugan. Pagbawas ng basura. Bawasan ang dami ng basura mula sa pinagmumulan. Paghihiwalay ng basura. Ihiwalay ang mga basura ayon sa kulay ng mga lalagyan. Ligtas na pagkolekta at paghawak. Gumamit ng personal protective equipment or PPEs at sundin ang mga pamantayang pamamaraan ng paghawak ng basura. Storage o pag-iimbak ng basura. Siguraduhing ligtas at may tamang label bago dalhin. Treatment o gumamit ng kemikal na disinfection depende sa uri ng basura. Disposal, ang pagtatapon ng basura ay dapat sumunod sa mga batas pangkalusugan at pangkapaligiran. Sa pagtatapos, ang wasto at ligtas na pamamahala ng basura ay mahalaga upang maprotektahan ang mga nagtatrabaho sa ospital, mga pasyente at ang buong komunidad. Ito ay upang mapanatili ang kalinisan ng kapaligiran at kaligtasan ng karamihan. Salamat sa pakikinig. Sana'y meron tayong natutunan sa araw na ito at kung meron katanungan, maaaring makipag-ugnayan sa Infection Prevention and Control o sa mga ka-RizalMed.
Department of Health, Rizal Medical Center, Safety Committee, presents Workplace Ergonomics and Safety. What is ergonomics? Ergonomics is designing a job to fit the worker so the work is safer and more efficient. Implementing ergonomic solutions can make employees more comfortable and increase productivity. This is key. Ergonomics is important because when you're doing a job and your body is stressed by an awkward posture, extreme temperature, or repeated movement, your musculoskeletal system is affected. Your body may begin to have symptoms such as fatigue, discomfort, and pain, which can be the first signs of a musculoskeletal disorder. What is a musculoskeletal disorder? Musculoskeletal disorders, MSDs, are conditions that affect your body's muscles, joints, tendons, ligaments, and nerves. MSDs can develop over time or can occur immediately due to overload. What are the advantages of ergonomics? First, increased savings, fewer injuries, more productive and sustainable employees, fewer workers' compensation claims. Second, fewer employees experiencing pain and improved health in general. Implementing ergonomic improvements can reduce the risk factors that lead to discomfort and musculoskeletal disorders. Third, increased productivity. Ergonomic improvements can reduce the primary risk factors for MSDs, so workers are more efficient, productive, and have greater job satisfaction. Fourth, increased morale. Attention to ergonomics can make employees feel valued because they know their employer is making their workplace safer. And lastly, reduced absenteeism. Ergonomics leads to healthy and pain-free workers who are more likely to be engaged and productive. primary risk factors. The following are factors for developing an MSD: force, heavy lifting, push or pull, carrying, gripping, awkward or prolonged postures, repetitive activities, overhead work, contact stress, vibration and extreme temperatures. Ergonomic solutions: stressed position, bent awkward posture. Best solution: relaxed posture with less pressure on the back. Stressed position, bent posture. Best solution: extension handle allows for natural posture. Stressed position, seat is too small and provides minimal support. Best solution: higher back seat with lumbar support and more support under legs. Ergonomic solutions: stressed position, using manual screwdriver with bent wrist. Best solution: used of powered inline screwdriver allows for straight wrist. Stressed position, no neck support or padding under the body. Best solution: creeper gets worker off flow and provides neck and shoulder support. Stressed position, bent posture and extended reach. Best solution: tilt table brings work within reach. Workstation setup: ensuring proper monitor placement directly in front, top at eye level, keyboard and mouse placement close to the user, and a comfortable desk height. Chair selection: choosing a chair with adjustable features like height, backrest, and lumbar support, and ensuring it provides adequate support for the spine. Posture and movement: maintaining good posture, avoiding prolonged sitting or twisting, and taking regular breaks to stretch or get out of the chair. Tools and equipment: using ergonomically designed tools like keyboards and mouse, and making sure devices like phones are held in a way that minimizes strain. Work environment: addressing factors like glare, lighting, and temperature to create a comfortable and conducive workspace. Breaks and stretching: incorporating regular breaks to stretch or move around, and switching to different tasks to avoid repetitive movements. Benefits of ergonomics in the office: reduced risk of musculoskeletal injuries like back pain and carpal tunnel syndrome. Improved comfort and productivity, enhanced job satisfaction and reduced stress. And lastly, increased employee health and well-being. Thank you for your attention.
Thank you again to everyone who participated in this year's safety training. Your active participation is crucial to maintaining a secure environment at Rizal Medical Center. We'd like to extend a special thanks to the following teams and individuals for their essential contributions in leading and preparing the training: Dr. Julius Miranda and the entire Infection Prevention Control team. Engineer Christine Joy Wan and the engineering team. Dr. Joel Contreras and the physical rehabilitation team. We hope everything you learned will be actively practiced and implemented in your daily work here at the Rizal Medical Center. Your dedication is our best defense. Here's the link and QR code for the post-test and played.